from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back to Good Morning Arkansas, everyone. Baptist Health has a new technology that makes it easier for patients to connect with their loved ones. Definitely important after the past year that we've experienced. Here to explain more this morning is Courtney Matlock, Baptist Health's Corporate Vice President for Continuum of Care. Courtney, thank you so much for joining us. What is this new technology?
Thank you for having me. Our new technology is called BH3C. So obviously the BH stands for Baptist Health, and 3C stands for Care, Connect, and Communicate. And we use that because it kind of helps explain all of the great features that this new technology can provide. Overall, this technology is just an important part of Baptist's mission to provide access to Arkansans through virtual care and through innovation, and connect families. And like you mentioned, it's been a difficult year for that, and also connect our providers to those patients.
Absolutely. So important. I love that you guys have been able to develop this. So where exactly is this new technology being used then?
Good question. So we have this technology in all of our Central Arkansas hospitals. So that includes Little Rock, North Little Rock, Conway, Arkadelphia, Malvern, Stuttgart, and Heber Springs. And so we're able to really span a very large location with that, and it's available in all of our patient rooms currently.
Incredible. Now, something that I have learned from reading up on this a little bit is that physicians can use this as well for kind of like a telemedicine. Tell me about that.
That's right. So in the rooms, the provider can actually access the patient rooms no matter where the patient is, and talk to them. And they can actually bring in family members in that discussion. And they can also bring in interpreters. So it's a way for our providers that are specialists to see patients no matter where they are. So if they're in a rural area, we're allowed to now access them, give them care before transferring them, or deciding maybe they don't need that extra care and that they can stay in their hometown locally. And they can also bring the family members into that call and discuss that plan of care with them, which is important. Obviously, some of the visitation policies have changed over the last year. So this has allowed us really to stay connected and keep the families educated on what's going on with that patient's care.
Absolutely. So I want to know, tell me about the impact you've seen. How does this kind of connection that you've been able to provide between doctors and patients and loved ones truly improved care? How do you think that's working?
Well, first of all, it helps the patient's spirits by seeing their family members. They light up whenever they can see not only their sons, their daughters, their husbands, or their wives, but when they see that specialist from Little Rock that's able to talk to them about specialty care when they're in a very small community, it's very uplifting. You can tell that they just feel like they've had the best care possible, which is important for us. One other thing that this product has that we haven't really talked about is that we also have tablets in the patient's rooms. So each patient can call their family member from those tablets, and they can have around the clock communication with those family members. So it's at their fingertips. And then also we have the specialist feature as well. And so it's been incredible.
As someone who has experienced having a loved one in the hospital and not being able to see them, I completely can see how beneficial this has been, being able to connect patients to their loved ones especially. So Courtney, what are some of those specialties specifically that are using this new technology?
Well, so we roll new specialties out almost regularly, but currently we offer cardiology, pulmonology, infectious disease, which has been very important over the last year, wound care, behavioral health, lactation, and then we have all other sorts of specialty care like nutrition services and care management, and other ways for our providers to access the patients. And our nurses also on the floors can access patients through this as well. So if it is a COVID patient, they can talk to them a lot more than they could before because they had to put on the PPE. So really all of our staff system-wide can have access to that patient's care.
Quite a broad spectrum you are impacting there. Well, Courtney, this sounds like you have really kind of invested into what could be a huge future change moving forward. And I'm glad that this is something that you have been able to do for doctors, patients, and their loved ones. So if our viewers would like to learn more about this new technology or the services you provide, where can they do that at?
It's a good question. So our website's always the best location to find more information. If you do have a loved one on one of our patient floors, please ask your nurses about this. If you have questions or if you've not seen it, you should. But if you haven't, please feel free to access and talk to them about that. And then we also have our Baptist phone number, which I think that will show soon.
Yes, we have all the information on the screen. So Courtney Matlock, thank you so much for coming on and sharing this information with us.